Hey guys, so I recently had to have a couple of teeth extracted, 13 and 19 or 13 and 19, not sure. I was in a tremendous amount of pain, and I was able to get in to see a friend who's a dentist, and she prescribed some penicillin for me. And I started on that on Tuesday when I saw her. And then she gave me a referral for an oral surgeon to do the extractions and potentially implants. And I wasn't able to get in to see them right away. They needed the referral emailed, and I had a paper referral, and then she took care of that right away, but I hadn't heard from them, and the infection and the pain had become just unbearable. So this was Thursday morning then, and I got some information about a couple of other dentists in the area, oral surgeons. So I called around, and I was able to get an appointment at 2 o'clock on Thursday that day for potential extractions. They were going to do their own x-rays, which, you know, I respect, and I can appreciate them looking into it. So they surmised, yes, that's what needed to be done. And thankfully, they were able to do both extractions. And they also, I chose the implants because of the top tooth is part of my smile line, so you can see that. So I wanted an implant there with a crown. The bottom one, the tooth in front of right in front of the extracted tooth is really loose, and the dentist said that is because of the way that my bite has been since I lost the cap on this lower tooth that was extracted. The cap, part of the cap had come off, so years ago, 4 or 5 years ago maybe, and he said, so all of my teeth were hitting this one tooth right in front of that. And I had noticed it was a little loose and kind of sore, so he said, you know, if you go without it, you might lose that tooth as well. So had the extractions done, had the implants put in. Everything went great. Continued to take the antibiotics, had some swelling, still have a little bit of bruising and a little bit of swelling, but mostly it went down. And then their office is closed Friday, Saturday, Sunday. I did the protocol that I was given, felt the way I think I should have. You know, I felt not terrible. The pain was just different, or the discomfort. I didn't have that pain anymore, and that was just the pain, the ache was in my entire jaw, my face. And my face had turned bright red and was very hot to the touch, all the way down into my neck. So yeah, so that's what prompted me to call around, because I knew I was going to be in trouble. And that was even while on the penicillin. So anyway, yesterday was Monday, and as promised, his office, the oral surgeon's office, called to see how I was doing. I told them I'm doing great, feeling really good, no pain really to speak of. Everything seemed great, but I told him that I'm having I'm still numb in my chin and up kind of through here, like right under my lip. I can feel myself like touching it, but I can tell that it's still numb, and it feels kind of fat, or I don't know, thick through here. So like this kind of area through here is still numb. And so he reacted very promptly, and you know, was a little concerned, just, okay, I'm gonna have you come in tomorrow morning at 8 o'clock, and called in a prescription for prednisone for me. He said, start it right away tonight. Next morning I went in, which brings us to today. It is Monday morning. No, is it Monday or Tuesday? Tuesday morning. And so I went to see the oral surgeon this morning, and they did some checks, and they used the pokey tool to see if, you know, what I could feel. And strangely enough, I could mostly feel the pokey tool. Like I could feel the poke. I don't know how hard he was poking. I don't know if he was putting a lot of pressure or if it was just ever so slightly, but I could oddly enough, I could feel it most of the time. I think only a couple of times did I not really feel it much, which was in here on the inside somewhere, and then right around that tooth that had been extracted, the gum line there, like directly around it. I believe that's what it was. But otherwise I could feel it all. And that I was shocked by that. He was a little surprised. He said it's really weird, it's odd, he said, that you're feeling those sensations, but yet, but they believed me. I mean, they weren't, saying, oh, you're, making this up or whatever. They fully believed me. They were really good about it. So they just said, okay, well, let's keep on the prednisone and finish out your antibiotics, because there was an infection in there. There was an abscess in there, and he scraped that out or whatever. It was at the root of the foot, or it was at the root of the tooth, I believe, which explained why I was so achy, I had a pulsating ear pain. I mean, I was waking up every morning with headaches and nausea, and yeah, I could tell the infection was gonna be out of hand. I had to get it taken care of. So anyway, so I'm contending with this. I don't know, have any of you experienced anything like this? Anyone have any experience with anything like that? Or like this? It's different because it's not that I can't, I can feel pressure. Well, I think if I didn't know that I was doing this to my chin, I wouldn't feel it, maybe a little bit of pressure. Like I can feel the superficial poke of my nail, but it's almost like it's a deeper numbing. It's like deeper than that. It's in the deeper tissues. I don't know if that makes sense. I don't know if that's a thing. I'm not a doctor, I'm not a dentist, but that's the only way that's the best way I can describe it. And then when I took my antibiotic this morning, before I went to the dentist office, I took my antibiotic and then I could feel something like tickle down here. And I thought, oh, well, that feels like I'm getting some tingling. That's good, right? That might be a good thing. And then I went like this and I realized I had dribbled water when I was taking my antibiotic. I'm like, oh, that's not good. So, and it wasn't bad. Like I noticed just a little bit here of, I don't know if it's like off, my smile's off just a tiny bit. Most people probably wouldn't even notice it. I notice it, my husband notices it, but this area too feels really like thick. But anyway, the only thing I could find online were wisdom tooth extraction and issues from that. And even the dentist, the oral surgeon, said this is really different. They hadn't experienced this before. And, everything I read was mostly with people having had their wisdom teeth out, but nothing that I guess described exactly what I was describing. The bruising is just from the actual extraction and him, kind of having to crank on the jaw, not crank on it, but you know what I mean. Anybody who's had a tooth extracted, kind of how it is. They have to put pressure to, be able to get that tooth out, and because your teeth are really in there. But the procedures went great. I mean, he said everything was normal, when he took the teeth out, and it seemed so. It seemed to go very smoothly, actually. I had 2 other teeth I needed extracted as well on the other side, but obviously we had to do the ones that were of greatest concern, because they squeezed me in. So with that said, I would just love to hear if any of you have had any experience like this or know anything about this. It's just odd, and I'm a little nervous because I was hoping, let's see, I'm on day 2 of the prednisone. It's a pack, so I started yesterday, I think it was. I think I started last night and took like 6 of them, and now I'm already starting to wean. I think it's a 6-day course. And I was really hoping to wake up and just be like, oh, yay, it's gone, but it hasn't really changed at all. And that concerns me a little bit. I'm very grateful and thankful that it's not really affecting me that much. It's just more of a like, okay, like it bothers me just knowing it's there. And I can see it a little bit, like I feel like you can see that it's a little bit, but, oh, and I have to backtrack a little bit. The oral surgeon also said that, you know, he really checked things over really well. He's not dismissing this by any means. He checked it over very well. He said there is still some swelling in here. So that's probably what I'm feeling, you know, when I'm pressing on it, that puffiness, which is what the prednisone is supposed to be for, to kind of get that inflammation down a little bit. But I haven't noticed a difference yet. This was real swollen. It still is a little bit, but not as much. And that went down almost the same evening I started taking the pills, really. Or was it that morning? I think it was the morning, actually, that it already started going down. And then at the end of that night, it was almost gone. But it's hardly there anymore. It's just in here. But he did say there was some swelling in there. And I don't know, I'm just a little concerned about it. I guess we're just kind of waiting. I'm getting my stitches out in 2 weeks, just over 2 weeks. No, about 2 weeks exactly. And in 14 days. And so they're like, you know, if anything changes, especially bad, give them a call immediately. I mean, they're being very proactive on it. They're not, you know, sitting idly by. They are concerned as well. You know, they're not just shoving me off saying deal with it. I mean, they're being really good about it. But I'm concerned, and I would love to hear anybody else's thoughts on this. Have you experienced anything like this? Do you know anyone who's gone through this? Any tips, tricks, any thoughts? Yeah, it's, I've had a lot of dental work done because when I was really young, I had a lot of cavities at one time. So I have had a lot of issues with my teeth because of that. And this is a continuation of that. Take very good care of my teeth now, but all of that damage that had been done over the course of those first, 15 years or so of life-ish, has caught up to me. And, I keep having to have like the fillings redone or caps put on. And, now we're into implants and crowns. We're in that stage at, almost 53 years old. So, with that said, just really curious if anyone has experienced or gone through anything like this. I'm a little nervous. Like, what if it doesn't come back? What if it stays like this? And, this is kind of, this is impacting me as far as, I still have more dental work I need done, and I'm really nervous now. I'm nervous. Is this going to happen again? What if this doesn't go away? And, I can tell, and I forgot to mention this to him, but even inside my mouth, even though I could feel the pick of the tool, when I go like this, or when I go to like kind of bite on my cheek, I can't really feel myself biting. And that scares me too. That scares me. Because I don't want to be biting up the inside of my cheeks and not even realizing it. Right now, it's kind of easy not to, because I've got, I'm a little sore here, and I'm keeping my tongue away from that side of my mouth, and, just eating soup and that soft food, and, but going forward, I'm just, he seems to think it'll come back, but he did, say sometimes, there's times where it might not, but, or that there are times when it doesn't, but he seems to think it would, and, or that it will. And I hope he's right, even if it takes 3-6 months or whatever, it just makes me a little nervous. So, talk to me down in the comments, my friends. Let me know your thoughts. I'm very curious. All right. Thanks. Bye.